hidden billions vanishing from healthcare. We're zeroing in exclusively on the healthcare side of things, the massive fraud crisis eating away at government-funded medical entitlement programs. In a quick intro here, the core healthcare aspects boil down to this. Sham providers in hospice and home health services are billing for patients who don't exist, services that never happened, and care that never gets delivered. They set up empty offices or rundown buildings, steal beneficiary identification numbers, certify healthy people as terminally ill, and rack up sky-high claims with just one or two vague service codes. The result? Billions in taxpayer dollars vanishing into luxury cars, private jets for some operators, and shell companies that pop up overnight, all while the programs meant to help the sick and elderly hemorrhage cash at rates that have doubled in recent years without any matching growth in actual need or population. It's not glitches or paperwork slips. It's engineered extraction on a national scale. Before we proceed deeper into this examination of the healthcare fraud mechanisms, a brief note. Should any element of this analysis, be it a compelling fact or a clear logical insight, strike a chord with you, please consider showing your support by liking the episode, sharing it with others, and following for forthcoming discussions. Alright, let's ease into this with a spoiler-free teaser. Imagine walking into what looks like a legitimate medical setup for end-of-life care or at-home recovery support. You expect compassion, real nurses checking on folks, maybe some equipment humming away. Instead, the doors open to silence, blank walls, zero patients, and a parking lot full of high-end rides that scream sudden wealth. That's the vibe we're unpacking today, but without spoiling how deep the rabbit hole goes just yet. Stick around because once we pull back the curtain, you'll see why this isn't some fringe issue. It's a symptom of how centralized health funding invites predators to feast while the rest of us foot the bill. Now, here's where it gets real, the full breakdown of what's actually happening in these healthcare programs. Providers register what amount to ghost operations in hospice and home health. They enroll beneficiaries using stolen or fabricated IDs. Often people who aren't even ill or who have no clue they're supposedly in care. Billing rolls in at thousands per head per month, sometimes hitting 30 grand or more per fake patient, with claims that list maybe one or two generic codes like basic monitoring or a single visit that never occurred. Audits reveal clusters of these outfits stuffed into single dilapidated plazas or motel conversions. Dozens of agencies, sharing the same address. All billing millions while the buildings sit empty. No furniture, no staff logs, no medical records that hold up. Yet the payments clear fast because the system runs on self-reported data and quick reimbursements to keep the flow going. In one hotspot alone, over 100 such entities pulled in hundreds of millions combined, with per claim amounts that defy any real-world care logic. And it scales. Official tallies show hospice and home health sucking up 1 out of every 10 national dollars in those categories from certain urban clusters, even as the actual number of people needing that level of support hasn't exploded. The fraud isn't subtle once you look. Operators flip licenses, launder proceeds through family networks, and recruit patients with kickbacks or straight-up identity theft. Medicare and Medicaid-style entitlements pay out regardless because verification happens after the fact, if at all. Empty rooms get certified as active care sites. Healthy seniors get labeled terminal to lock in long-term payouts. And the money? Straight into fleets of luxury vehicles parked right out front, as if daring anyone to notice. This isn't isolated. It's patterned across entire regions, with new shells spawning as fast as old ones get light scrutiny. Recent enforcement actions charged hundreds of defendants for schemes totaling $14 billion in intended losses in a single year, including fake hospices billing for non-existent services, while patients suffered real neglect elsewhere. The program's own data shows improper outflows hitting $96 billion across major health entitlements last fiscal year alone, with hospice categories ranking among the top drains due to phantom claims. Let's tear into the themes and analysis here, using pure logic and reason to dismantle any weak pushback that tries to downplay this as mere errors or administrative hiccups. First off, the scale destroys that nonsense cold. We're talking trillions cumulatively in improper flows over 2 decades, with annual fraud estimates from watchdogs landing between 230 and 520 billion government-wide. If this was just sloppy paperwork, why do the patterns repeat identically? Empty facilities, minimal service codes, explosive billing growth without population spikes. Errors don't produce fleets of high-end cars or operators living like kings off non-profit medical work. Logic says when incentives align for easy money, quick payments, weak upfront checks, and diffuse bureaucracy, rational actors exploit it. That's not a glitch. That's the design flaw in any system that centralizes redistribution without market discipline. In a free market, a fake provider charging for zero care would bankrupt itself the first time customers walked away or competitors exposed them. Here, the customer is the distant taxpayer pool, and payments flow automatically. No skin in the game for the bureaucrats approving claims, so fraud thrives. Dig deeper, the complexity itself is the trap. Massive entitlement structures rely on third-party billing, self-certification, and layers of managed oversight that no single person can track in real time. Providers game the codes, inflate beneficiary counts, and hide behind insufficient documentation excuses. 77% of one program's improper hits by the numbers. But reason it out, if documentation fails consistently in clusters yielding luxury lifestyles, that's not innocent oversight. It's deliberate concealment. Any counterclaiming most isn't fraud gets crushed by the math. Even conservative slices of those billions match the luxury evidence and enforcement hauls. Official recoveries? Pennies on the dollar compared to losses. If it was fixable with tweaks, decades of audits would have plugged it. Instead, the problem compounds because the underlying philosophy, centralized command and control funding, mirrors the old Bolshevik model of redistribution without accountability. It creates a permanent underclass of dependents while empowering a predator class of operators who treat the system as their personal ATM. Authority-oriented enforcement could hammer this with real-time data crosschecks and asset seizures, but the inertia favors expansion over excision. Quotes from the raw data and investigations drive this home without fluff. One audit summary puts it plain. Claims associated with hospice care rank among the largest categories for improper outflows, with patterns of non-existent services and ineligible enrollments driving the bulk. Another enforcement roundup. Sham companies submitted fraudulent claims for services never provided, including for individuals who were not terminally ill and never received care. A watchdog breakdown nails the incentive trap. Underinvestment in controls is self-perpetuating. Lack of resources guarantees underdiscovery, which perpetuates more underinvestment. And on the ground reality, hundreds of entities in concentrated areas show every red flag. Ghost patients, shell registrations, and proceeds funding lifestyles far beyond legitimate operations. These aren't opinions. They're the system's own confessions, exposing how the machine rewards deception over delivery. Wrapping this chapter with a clear recommendation and some final thoughts. We need a hard pivot to authority-oriented accountability, mandatory real-time beneficiary verification, AI-assisted cross-checks on every high-volume claim, immediate license revocations for empty site operators, and clawbacks tied to personal assets, not just corporate shells. Layer in free market elements where possible. Let competition and patient choice expose fakes faster than any bureaucracy ever could. Until that happens, these programs will keep bleeding, diverting resources from actual care and inflating the debt load on everyone. The logic is ironclad: systems without discipline invite plunder, and this healthcare fraud machine proves it daily. If we value real help for the vulnerable over performative redistribution, it's time to dismantle the incentives that make fraud the smartest play. That's the truth, plain and simple. Catch you next time as we keep digging deeper. Stay healthy, stay safe from fraud, stay free.